Are you suffering with sciatica symptoms and wondering what you can do to help them? Or maybe you're wondering if what you have is actually sciatica. Well, you're in the right place because today we are answering all of your sciatica questions. I'm Dr. Amy with Physical Therapy for Everybody, and here we focus on creating an active, healthy, and confident lifestyle without pain medication or surgery. And I can definitely guarantee you that you probably don't need surgery for your sciatica symptoms. And today we're going to talk about why. So first we're going to start talking about what is the cause of sciatica. So the two most common causes of sciatica are one, a disc herniation or prolapse. So that's where the disc in the spine kind of bulges out, or sometimes it kind of spurts out some of its stuff. It's not actually a fluid, but the stuff comes out of the disc and it irritates the sciatic nerve, which is actually being formed in that lumbar spine. So then it gets irritated, which the sciatic nerve is a nerve. When it gets irritated, that is sciatica. There we go, got that one out. Okay, so it gets the sciatic nerve irritated, which causes the sciatica and the pain down the back of your leg. The other most common cause that we see is that the sciatic nerve is getting pinched or choked out basically by the piriformis, which is a muscle that's in your butt. It's really pretty deep in your butt. And it gets, the sciatic nerve either travels underneath it, through it, or on top of it. If yours travels underneath or through it and it gets tight, it can put a lot of pressure on the sciatic nerve, which can cause sciatica. And how do you know which one you have? It's where is your pain originating from? So is your pain originating from your low back, which is kind of your hip level? If you put your hands on your hips, you're right in your low back or your lumbar region. Or is it starting more deep in your buttocks? So on closer to where you sit, right? That usually tells you what is causing your sciatica symptoms so that you have a little bit better understanding. But most of the time it also will travel down the back of the thigh, and that's how you know it's sciatica. That's kind of the trademark or hallmark of sciatica type symptoms. Which is the next question, what are the symptoms of sciatica? So again, most commonly it's either low back or buttock pain, and then it will travel down the back of the thigh. Now technically the sciatic nerve does travel on the outside of the knee, where it splits into two different branches. So some people do have pain on the outside of the knee and down into the calf and the side of the leg, but not everybody has that. So at least not in the beginning. Sometimes people start with pain like in the buttock, down the back of the leg, and if they don't get treatment for it, it will progress down past the knee into the outside of the calf and the back of the calf. But not everybody has that happen. So hopefully you are not at the point where that's happening yet, and you can get some treatment and do some things to help yourself now before it progresses to that point. How long does it take for sciatica to go away is a common question that we get asked here. And the answer is a little bit complicated because the truth is it will go away when it stops having pressure on the sciatic nerve. Right? Sciatica is caused by pressure on the sciatic nerve. When the pressure goes away, the symptoms will go away. So if it's from a lumbar disc that's herniated or prolapsed, usually that takes about 4 to 6 weeks for that to heal and to stop prolapsing. So then it'll be about 4 to 6 weeks, the pressure will be released on the sciatic nerve, and then you'll stop having symptoms. However, if it's in the piriformis has to be loosened up. And so that usually can take a lot longer because there's something that caused that piriformis to get tight in the first place. And you got to actually figure out what caused the piriformis to get tight in the first place, because that's what's putting pressure on the sciatic nerve. And so until you figure out kind of that root cause of what's causing that problem, then you're never going to relieve the pressure of the sciatic nerve, which means it's just going to continue on. And unfortunately, it's most likely going to progress. So how do I get my sciatic nerve to stop hurting? So this is a very common question that we get asked, especially when it first happens, because when it first happens, if you've had it or if you're suffering with it now, you know it is sharp, it is often sudden, and it is super, super painful, and you feel like you cannot do anything. So in that situation, what can you do safely? You're gonna put some ice on the area that hurts. So if it's starting in the low back, put ice on your low back. If it's starting in the hip, put the ice on the hip. If you have ice in your low back and your hip, put ice on both. If you only have one ice pack, switch between the two. Now, research indicates that we just need to ice for 5 minutes at a time. However, if it's feeling good and you finally found some relief for the first time all day, feel free to go ahead and ice for 20 minutes at a time. Just give yourself a break in between icing to make sure that the skin warms up. And we don't want any frostbite from ice packs. Like, that's a really disturbing thing. I have seen that before, so please don't do that. And definitely I recommend putting your ice pack in a pillowcase or with a dish towel. Sometimes dish towels are a little bit too thick, so I prefer the pillowcase, but again, that decreases the frostbite. So definitely take care of your skin here, friends. It's very important. What's the best way to relieve sciatica? So initially when the pain symptoms start, the best thing you can do is the ice. The ice decreases the inflammation, and then that helps to calm everything down a little bit. So then usually you can get up and move on to the next step, which is movement. So we want to clear the inflammation out away from the sciatic nerve so it stops getting irritated, and that's going to require movement. Now, a lot of people are really scared to move because they're afraid it will hurt more, and I totally get that. So definitely proceed with caution when you start moving. I recommend for people to start usually just walking around their house, not necessarily even in the yard. If things are really feeling unstable and really painful, I don't even want you walking on an uneven surface, but just walking around the house, walking as slow as you need to feel comfortable. I don't want you to feel, sometimes when you're walking fast, you kind of get into your zone and get kind of rigid. We don't want that, okay? We want you to feel really comfortable with walking. I mean, as comfortable as possible. I know when you have pain shooting down the back of your leg, it's not super comfortable, but you should feel better as you're walking around the house as opposed to worse. If you're feeling worse, you may be walking too fast, or you may not be breathing while you're walking. So that's definitely something that we do see here a lot, is that people get with their pain, which often causes anxiety and stress, right? Because you're in pain, so that's a problem. That people stop breathing correctly. They stop doing that deep belly breathing, getting that diaphragm moving. We have tons of videos on that. You can watch those in a minute. But making sure you're doing that deep breathing so that you're getting that full oxygen flow. It also helps to decrease the stress hormones in your body and gets you some gentle movement, which will make your body feel better. Now, gentle movement. Did you hear that? Gentle movement. I don't want you doing anything that increases your pain. Okay? Because when you increase your pain, you're going to increase your muscle tension, increase your cortisol levels. Everything's going to go the wrong way. So if you're doing anything that's increasing your pain, again, I need you to stop right now. You cannot push into sciatica. Pushing more does not help you heal sciatica. Okay? The nerve is irritated. It's like a hot poker, right? You got to calm it down. So you gotta ice, you gotta breathe, you gotta move gently, and you gotta not do anything that makes anything worse. So you may not be able to vacuum your house for a couple weeks. You may have to get somebody else to vacuum your house for a couple weeks, because I guarantee you that's gonna cause that hot poker to come back. So now there you can say, the doctor told me I can't vacuum the house for a couple weeks because of my sciatica. There you go, you have your excuse. All right, so what should I do or what should I not do for sciatica? So what you should do, all the things that calm it down. You should be icing regularly, every hour. 5 minutes every hour is what I recommend. That's what the research recommends is the most helpful for decreasing the pain and getting things to calm down. I need you to do your deep breathing to decrease the stress hormones, and I need you to do some gentle movement. Most likely in the beginning, I recommend people walk around, because you kind of have to walk around, like to go to the bathroom and to go grab something from the kitchen, or to put your ice pack in the freezer, or to get another ice pack back out, right? You kind of got to walk around anyway, and so why not use that to help you get moving? Now, as things start to feel a little bit better in the beginning, I recommend that people walk a little bit further. So walking is fantastic for sciatica. And the reason why is it causes a little bit of rotation in the low back, as long as you're walking correctly, which helps to heal the disc. So if your sciatica pain is coming from a disc, the walking helps heal it. However, it also activates the hip muscles, which we talked about the piriformis putting stress on the sciatica, so that can also help with the sciatica type symptoms. So walking is good no matter which part is causing your sciatica pain to start. Walking will help to heal it. So initially I recommend just walking around the house and pretty much just walking as you need to, but definitely getting up every hour to walk around, drink some water, go to the bathroom, all that kind of stuff. Make sure you stay hydrated during this time. Really, really important for healing. But as you start to feel better, start venturing outside the house. Not far, maybe just around the block. If your block is like a quarter mile or a half mile. If your block is like 4 miles, which there are some blocks that are 4 miles, then that's too far. Maybe just down to the end of the driveway and back then. But starting at about a quarter mile to a half mile, as long as that feels okay, you can add a quarter mile to a half mile every time you go walking. If you get to the point where you find that you are not, you're having more pain with walking, then you need to scale it back. But again, walking is fantastic particularly for sciatica, although it's really good for so many different things. And usually it's pretty easy to do right where you are, and it is a great place to start. What should you not do? So in general, you shouldn't do anything that causes pain. And I know that seems really, really simple, but you would be shocked at how many people really want to continue doing different activities that they were able to do before. But with sciatica, you cannot push through the pain. There is no such thing as pushing through the pain with sciatica, because if you have pain, you're increasing the problem, okay? So we got to get rid of that. I just got to push through this. Nope, nope, nope. You do not need to just push through it, because it's not going to do you any good. It's only going to make things worse. So please don't do that. Specifically, any activities that involve flexion, which is forward bending, extension, which is backward bending, and rotation together. So think about as you're going to plug in the vacuum cleaner, that's a very common one. Bending over to pick up the soap in the shower. Again, these are things that often trigger sciatica in the first place, but it's that bending forward or bending backward with the rotation that really puts a lot of stress on that disc, which is what causes the prolapse or the herniation and causes those sciatica symptoms to start in the first place. So definitely make sure you're staying in straight planes, forward bending, backward bending, all within pain-free motion. Do not, again, please hear me, do not go into painful positions. With sciatica, you're only making things worse. I can guarantee it. That is 100% truth right there. So only do things that are pain-free. Now, I said that walking does cause rotation in your lumbar spine, and that was good, and now I'm saying don't rotate. But hear me on this. Rotation is actually a great motion for the discs because it's what allows them to heal. So when the discs rotate, now I'm talking about just rotation, not with any flexion or extension. When the discs rotate, that's actually what causes the healing, because they're kind of like sponges. And so when they rotate, they kind of compress, and that causes all the waste material to leave. And then when you derotate or come back to neutral, is what we say here in the PT world, then it allows the disc to plump back up, and it pulls in all those good healing cells. So rotation is actually good if it's straight plane rotation. It's when you add in the flexion, forward bending, extension, backward bending, that you get into problems. That puts too much stress on the outer horns of the disc, and that's what's going to cause your problems. So I like a little bit of rotation with walking. I like that, but I do not like any rotation when it's combined with another motion when your sciatica symptoms are flared up. There we go, flared up. Now, I will say that as we go through treatment, when you're working with a physical therapist, if you see us in the clinic, obviously rotation with flexion and extension is a very functional movement, right? You do that all the time throughout your day, and I'm not saying you can't ever do it again. Please don't hear me say that, because I want you to avoid it for right now, because that's going to aggravate your sciatica symptoms. However, during the progression of treatment, we need to get you back to doing it, because if you're not doing it, then obviously that's going to cause other problems, right? Because then you're not moving normally, and movement is life. Movement is what allows those tissues to be able to heal. However, right now, I need you to avoid the pain. So go grab an ice pack, put it either on your low back or your butt, get everything to calm down, and then later on we'll work on your movement. What questions do you have from this video? I hope you'll drop them below, and then that way we can know what videos we can make to help answer all your questions. And click subscribe before you leave. We're making videos and uploading them every week so that we can get all this information out to you. Have a great day. Bye.